Diabetes by Kathleen Salang and Elisa Glayback. What is diabetes? Diabetes is a group of disorders characterized by hyperglycemia resulting from defects in insulin production, how insulin works, or both. Different types of diabetes is prediabetes, metabolic stage intermediate between normal glucose homeostasis, and diabetes. Type 1 diabetes produces little or no insulin. Type 2 diabetes is when the body cannot use the insulin it makes. Gestational diabetes mellitus is any degree of glucose intolerance with onset or first recognition during pregnancy. Glycosylated hemoglobin value, or HbA1c, monitors the average level of glycemia over preceding 2 to 3 month period. The value should be taken at least 2 times a year to monitor the patient's treatment goals. Normal value is below 5.7%. Safe to dental treatment is 6.0% to 6.9%, or ASA2. Caution with invasive treatment is above 7.0%, or ASA3. May need medical consult over 10%. Symptoms: type 1 diabetes, frequent urination, unusual thirst, extreme hunger, unusual weight loss, irritability, extreme fatigue, blurred vision, very dry skin. Type 2 diabetes includes any type 1 symptoms in addition to cuts and bruises that are slow to heal, tingling or numbness in the hands or feet, recurring to hard to heal skin, gingival or bladder infections. Symptoms. Common treatment modalities, common used medications. Approximately 12% of people with diabetes, either type 1 or type 2, use insulin only to control hyperglycemia. 58% use oral medications only, 14% use a combination of insulin and oral medications, and 16% do not take either insulin or oral medication. When treating those with diabetes in the dental office, we want to make sure that we are conducting periodontal risk assessments. We want to determine the need for co-management, especially with undiagnosed and or uncontrolled diabetes. And we want to modify our hygiene care plan on the basis of the patient's needs to help minimize potential risks for emergencies. And we also want to monitor outcomes of dental hygiene care. Additionally, we want to assess glycemic control. We can do this with a glucometer, which can be used to avert emergencies related to diabetes. We're going to schedule frequent recalls with our patients, and we are also going to support our patients in smoking cessation programs. With referrals with patients with diabetes, we want to watch out for the cardinal signs of diabetes. We want to pay attention to their fasting blood glucose levels as well as their HbA1c levels. We want to also pay attention to extreme hyperglycemia and hypoglycemia and any infections found anywhere in the body. Here are some examples of what questions to ask your patients, some of which include: what medications do you take? Do you ever find yourself disoriented, agitated, anxious for no apparent reason? Does your mouth feel dry? And when was your last HbA1c result? How dental services should be conducted in general. We're going to review patient's history, take vitals, evaluate oral signs and symptoms of inadequately controlled diabetes, recommend morning appointments, recommend the patient eat before appointments. We're going to coordinate with the patient's physician when necessary, and we are going to do assessments for signs of periodontal infection. And we have reached the end of our presentation. Although diabetes is a complex subject for many, with proper understanding, patients can be treated safely as well as effectively.